All right. Good afternoon, everyone. Good afternoon, everyone. Please let me know if you can hear me.
Yeah, we
Good
can hear you,
afternoon.
Sandra.
All right. Good afternoon. All right. You are all welcome to today's BLDP titled Leadership in Healthcare Innovation and Technology. You are all welcome. I would like to welcome our dear speaker, Mr. Odinaka Kingsley. You're all welcome, sir. You're welcome, sir. I would like to welcome our executive students. You're all welcome to today's BLDP section. Would like to read out some rules of engagement. All right. I would like you to know that this section is being recorded, and I would like to let you know that you are advised to pose in a very formal position so that by the time you will see a recording, this recording, you would be proud of the way you see yourself, all right? And okay, during the section, I would like you to know that you are not to unmute yourself. Stay muted throughout the section. If you have any question, do well to put it down in your notepad. During the time for question and answer, the moderator will call you out and you can now air your question out, okay? So, once again, you are welcome. I will now move over this program to the moderator. Over to you, moderator. Thank you.
All right. Good afternoon, everyone. Thank you so much, Sandra. My name is Chamaka, and I welcome you all to today's Business Leadership Development Program. Today we have our speaker, Mr. Odinaka Obeta. He will be taking us on the topic Leadership in Healthcare Innovation and Technology. We all know that the healthcare space is a very broad space and is a very important space in terms of living our lives. So we'll be delving into that today, and I'm very much sure that Mr. Kingsley is prepared for us today. And I'll briefly be starting with Mr. Kingsley's bio. Odinaka Kingsley Obeta is an award-winning biomedical scientist. He's also a global health practitioner and the co-chair of the RBM Partnership to End Malaria Youth Workstream, the world's largest partnership platform to coordinate malaria's efforts globally. He also serves as the vice chairperson of the African Leaders Malaria Alliance, that's the ALMA, Youth Advisory Council, where he advises African heads of states and governments on innovative strategies to ensure youth participation in malaria advocacy at continental, regional, and national levels. He is also the advisory founder and executive director of Block Malaria Africa, a grassroots organization working across vulnerable communities in Nigeria to improve access to malaria diagnosis, treatment, and prevention, while strengthening the health system at the primary care level. His work has led to the distribution of thousands of insecticide beds, nets, and malaria services to underserved populations and has influenced government health actions and policies. Odinaka is also a globally respected voice in healthcare innovation and health communication, having spoken or served as a panelist at several high-level convenings, including the World Health Summit in Berlin, that's in Germany, RBM Partnership to End Malaria Communication Workshop in Lausanne, Switzerland, Social Behavioral Change Annual Conference in Nairobi, Southern African Youth Forum in Harare, Zimbabwe, the Ghanaian Forum Africa in Dakar, Senegal. West African Conference in Lagos, Nigeria, amongst others. He was also selected as a juror for the Secure Hackathon on Biosecurity, organized by the Eco Innovation Center, where he evaluated tech-driven solutions for secure health systems. As a health advocate and communicator, Odinaka has been featured across various media platforms, including BBC, News Central, African Independent Television, AIT, News Channel, amongst others, where he shared insights on youth participation in global health, malaria control, and health system innovation. He also holds a Bachelor's of Medical Laboratory Sciences from the University of Jos and has earned multiple certifications in policy development, global public health, monitoring and evaluation, implementation research, and leadership in health from institutions such as University of Washington, World Health Organization, and the Leprosy Mission Nigeria. He is currently a postgraduate scholar at the Global Health and Infectious Disease Institute, Nasarawa State University, Kefi, Nigeria. He is also a prolific youth mentor and health advocate and has trained and inspired over 20,000 young people through public talks, webinars, and fellowships across Africa, Europe, and Asia. He has authored and contributed to several global health publications, including the 2022 Commonwealth Malaria Reports, the African Union Youth Conversation Guide on Malaria, and peer-reviewed studies on diagnostics, disease prevention, and insecticide research. Above all, Odinaka is driven by purpose, passion, and people. He is happily married to the beautiful love of his life and remains deeply committed to raising a generation of resilient, informed, and visionary young leaders across Africa. Wow. Mr. Odinaka, we are actually eager to hear from you today. We are eager to hear your insights on leadership in healthcare innovation and technology. I hope you are really prepared for us today.
Thank you so much, Shabaka. It's quite a pleasure to be on the call with you. And I really hope that preparation from my end is also able to match the expectations of the participants for today's conversation. So I'm looking forward to all that we have to discuss. And I really hope that by the end of the session today, someone goes on with at least one thing that is going to help inspire them to become that visionary leader that will drive innovation, especially in the healthcare industry. Yeah, so thank you so much. And I look forward to engaging further. Thank you.
All right, sir. So you can go ahead with your presentation today, sir.
Okay, thank you so much, Chamaka, for that. And I will say welcome to every single one who have made out time to be a part of today's discussion. It's a pleasure and an honor for me to be invited by the Rome Business School, Nigeria, to facilitate this session. I don't know what exactly you saw or what exactly drew your attention to myself, but then I believe that with the knowledge that I have and with the experience that I've gathered within the short time I've spent on the earth and within the work that I've been able to do, I would be able to share some insights that would be very valuable to the executive MBA class at the Rome Business School, Nigeria. So give me a second as I make an attempt to share my slide, but then just in case, Chamaka, I've also forwarded my slides to you. I made sure I was able to do that just a few minutes ago to ensure we don't have any technical glitch of any sort. All right?
Okay, sir.
Yeah. So I am connecting with you all from Azere local government area of Bauchi State. Very hot environment. I just came into this particular place a few days ago, and I am really happy. I know we have participants joining from different parts of the world, and I really look forward to our engagement. Let me see. Let's see. Chiamaka, can you make an attempt to share from your side instead?
All right.
Thank you so much. While Chiamaka is trying to do that, I think we can go ahead with our conversation. First of all, Odinaka Kingsley Obeta is my name, and I've been rightly introduced by the moderator for today's session. I think that is the most that there is about me. I'm not sure there is much information that is not captured in that introduction. So I would say thank you so much for the introduction. My name is Odinaka Kingsley Obeta. One of the things that I'm very passionate about is creating change, especially in an environment where change doesn't exist. I'm passionate about malaria elimination. I'm one of those few persons who believe that zero malaria is truly possible, especially in Africa and even in Nigeria. And as a medical laboratory scientist who is also contributing actively to public health, one of the things that I've been able to do over the past few years is to drive advocacy for increased investment for malaria elimination, as well as advocating for also the engagement of young people in the fight against malaria. So that is one of the major things that I've been able to do so far. Chiamaka, is that your screen?
No, not mine.
I'm not sure where that is coming from. But then have you found the slides? Okay. While Chiamaka is trying to do that, our conversation for today is one that is very important, especially in this time and age, is one that, is very, very critical. I think one of the things that make you an exceptional graduate of a master's in business administration kind of program is your ability to be able to think critically and also create solutions to existing problems. It is also one quality that I think is also required of you is to also have that ability to lead, and not just to lead, but then to create impact through your leadership. And this is one of the major reasons why I believe the topic for today's discussion have been centered around leadership in healthcare innovation and technology. This is what we're going to be looking at from the start of our presentation down till the end. We have a couple of objectives that we're going to be considering in the course of this presentation. And by the end of the session, generally, I believe that something should have changed, actually, when it has to do with you. So first of all, we'll be looking at, some key objectives. I want to believe that before the end of the session, participants, everyone on the call would be able to explain the importance of healthcare innovation, especially when it has to do with the African context and other low resource settings or other low resource communities. I also believe that by the end of the session, you should be able to also identify the various leadership styles that effectively support and drive healthcare innovation at different levels. And I also look forward to having you understand or recognize rather key ethical and regulatory considerations that exist in healthcare innovation and technology adoption. I'm also seeing the possibility of you understanding the value of cross-sectoral collaboration across multiple sectors. Before, I think when I got the invitation from Chiamaka and the entire team, I made a request to ask about the audience, that the participants of this webinar or of this class, what sector exactly are they coming from and where do they work? So I heard finance, I saw supply chain, data science, hospitality, amongst others, right? And this is quite a lot. So I believe strongly that by the end of the session, you would be able to see how your sector, irrespective of how far you think it's away from healthcare, is able to play a critical role in advancing healthcare innovation, and in also promoting leadership in the healthcare sector. So this is one thing that I believe is possible for us to achieve by the end of the session. All right. So we'll be looking at the importance of healthcare innovation, especially in Africa, and then in some of the low resource settings that exist even outside the African continent. And that is where our conversation for today would start. Chiamaka, I'm back again. I don't know if you have the slides ready. Let me know, please, if you're able to do that. And then I'm seeing that quite a lot of people are joining the call, so it's exciting to see. And I hope we have a beautiful conversation. Still not coming up. Okay, sorry for the breach in transmission. We're just trying to see if we can get the slides up, but I think Chiamaka is still trying to get it up from my end. I think I've been able to sort my own side. Kindly confirm that you can see the slides from this end. Chiamaka, if you're on the call, you can please unmute and just confirm that you can see the slide. Anyone at all can do that?
Yes, I can see the slides now.
Okay, fantastic. Thank you so much. So I think we can move now. My apologies for the delay. So I already read out some of the objectives that we're going to be looking at in the course of the presentation. And like I said, we're going to be starting our conversation, first of all, from looking at why innovation in healthcare is important, or why innovation is important, especially in healthcare. First of all, in our context in Africa, we have a number of situations, or we have a number of conditions that have warranted the need for not just innovation, but steady innovation, all right? We have a very dynamic situation. We are, first of all, under-resourced as a community. Our healthcare systems are suffering quite a lot. We lack access to a lot of resources. We also experience infrastructural gaps with respect to, be it machines or healthcare equipment, with respect to healthcare consumables, amongst others. There's also a lot of issues around data. We don't have sufficient data to drive, to drive advancement in some areas of, or most parts of our healthcare, space. We also have workforce shortages, which is one thing that is currently even affecting the Nigerian healthcare system, especially quite a lot, where the Japa syndrome have stepped in, and a lot of young professionals in the healthcare space are traveling to go seek for greener pastures in other countries that are developed, from Canada to US to UK, amongst several others, Australia, of course, amongst others, right? Now, because of the dynamic nature of the challenges we're facing, or we're faced with in our healthcare industry in Nigeria and then in other low and middle income countries, the question or the need for healthcare innovation have become very mandatory, all right? Now, it's not enough to drive towards innovation, because innovation in itself is not just technology. Innovation requires leadership. Innovation requires some level of vision. You need a visionary leader to be able to think about the need for innovation. Then you also need a visionary leader to be able to identify which area of a sector requires that innovation. You also need that a visionary leader to be able to drive the innovation from start down till the end. All right. Now, why is leadership important, or why do we need to, why do we need to bring in leadership when it comes to healthcare innovation, right? First of all, we have to come to understand that innovation is not optional. When it has to do with not just healthcare, when it has to do with different sectors of the economy, right? Innovation is not optional. Then there's a need for innovation in the security sector. There's a need for innovation in the food and agricultural sector. There's a need for innovation in the business sector. There's a need for innovation everywhere, right? So innovation is not optional. As far as man exists on the earth, as far as man, or human continues to grow on the earth, right? As far as our existence here is guaranteed, right? Innovation has to step in because our environment is changing, and so also is our problems, all right? So innovation is critical for us to survive. Innovation is critical for us to adapt. Innovation is critical for us to advance as a people, all right? Now, for us to drive innovation, we must implement a leadership style that is adaptive, that is inclusive, and is also system-oriented, all right? Because the concept of innovation, it differs from one sector to the other. The sort of innovation that one would require in the security sector, for instance, is not same with what is required for the architectural sector, is not same with what is required for the agricultural sector, for instance, amongst different areas. So we must be able to, introduce leadership and create a leadership style or drive a leadership process that is adaptive, that is inclusive, and that is keen, with the particular system where we want to introduce, a particular innovation into, right? Now, like I mentioned earlier, I learned that we have participants coming from different sectors. And while I was thinking through, I wondered, somebody might wonder why he or she coming in from the logistics sector or from the finance sector is important in this conversation, because we're discussing innovation in healthcare. And I just took time to say, okay, let us look at some of the cross-sectoral relevance of other sectors, all right, with respect to driving healthcare innovation, right? When we're talking about an individual coming from the logistics sector, let's say you're on the call and you're from the logistics sector, you play a critical role in helping to deliver life-saving vaccines and essential medicines to remote communities across different parts of, the low and middle-income countries, all right? If you're coming from the finance, we don't implement any healthcare innovation or introduce any healthcare innovation that is not backed by budget, that is not backed by, is not backed by a financial plan, especially when it has to do with innovations that require developing maybe a new healthcare system or developing maybe a health tech device or something, all right? So budgeting for scalable innovation is one area that is critical in ensuring healthcare innovation, and that is where you come in. HR, if you're coming from the human resource angle, in building innovation, we also try to ensure that we build teams that are going to help adapt this innovation. So whatsoever, be it an introduction of a health tech device into a new healthcare facility, there's a need to carry out trainings to equip the healthcare professionals working in that center, with the new technology that have been introduced. And HR usually would come in from this direction, or probably even in hiring the right kind of individuals that can help utilize this innovation, all right? If you're coming in from supply chain management, we're looking at you contributing towards the area of ensuring last mile delivery of healthcare tools, from vaccine to essential medicine and to bednet to various other resources that are required, in the supply chain, in the supply chain system, all right? If you're coming from data science, enabling precision decision-making is one area, ensuring that every decision that is made with respect to healthcare is done on the basis of accurate and, updated and available data, all right? Project management, we don't have healthcare innovation without a leader who is experienced in project management, because your capacity to be able to coordinate the team to be able to ensure that the outcomes of a particular healthcare project is achieved is something that we look forward to achieving. So you must not necessarily be a healthcare professional in the system. If you're coming from project management sector, you can accurately, contribute actively towards ensuring not just the development of an innovation in healthcare, but even down to its implementation, all right? So let's move to the next slide. This is just by way of introduction for us to see how important innovation is to healthcare, and then to also see why we have to keep innovating in healthcare, as well as to also have a picture of how every sector or most sectors represented on this call can play or are already playing a critical role towards ensuring the implementation of various innovation. All right. Now, what are some of the trends that have shaped healthcare innovation, especially in the recent times? Quite a lot of technological tools and ideas have been able to help us achieve better health outcomes. They've been able to contribute actively towards ensuring that the quality of healthcare that is provided, especially even in low and middle income countries, they're able to not just that the healthcare services are accessible, but then innovations have helped us to ensure that these healthcare services are of good quality and that they are also affordable, especially to communities that are quite remote. All right. Now, some of the trends that we have that are shaping healthcare innovation includes artificial intelligence. All right. And through the use of artificial intelligence, we've been able to, go to an extent, like we've been able to progress in diagnostics for cancer, for tuberculosis, for diabetes, and quite a number of other diseases. We still have a very wide range of, healthcare innovations that are currently in the works and are using artificial intelligence and are also contributing actively towards ensuring good quality of healthcare services. All right. In Nigeria, we're having AI-powered chatbots that are now being used and tested for maternal health consultations. I think there are a couple of startups in Lagos that have been recently funded to be able to help develop some of these chatbots, and they're currently in their testing phase, right? So this is one trend that we currently have. Electronic health records. This one have lasted for quite some time now. Anyway, the use of electronic health records that have made healthcare information available, on digital platforms, and has helped a lot to ensure that, patients' information is not just available, but then it is accessible by healthcare professionals within a particular healthcare network. All right. Now, the DHIS2, for instance, right, the district health survey is currently used in over 75 countries, including Nigeria, and it helps in disease surveillance. It also helps to showcase, disease burden across different regions. This, by the end of the day, gives us a picture of what is happening in certain environments or certain communities, or with respect to certain illnesses in a particular country, and and then helps to drive policies or helps to increase investment or financial contribution towards, a particular healthcare issue, all right, or towards supporting the healthcare industry in a particular country or in a particular community. All right. So we have quite a number of these already on the ground. The digital patient records is helping to improve continuity of healthcare or the continuity of care. All right. And it's also helping us to track epidemics, especially in communities where, certain disease conditions or certain infectious diseases are prone to, to break out. Right. So these digital health records or electronic health records help us to transmit information about the situation of a health outbreak or disease outbreak rather in a particular community in real time. And when this is done, there is a need, prompt response is taken, and we're able to make tangible progress in that regards. All right. Now, we also have the use of mobile tools and mHealth tools, right? The use of mobile apps, or quite a number of that. We have mobile apps. We also have like the use of wearables, like you have your wristwatches in these times. There are wristwatches that you can use to track your footsteps. You can use to, monitor your heart rate, amongst others. So at the same time, we have mobile apps that are used to track antenatal care. They're used to report malaria cases. Some of these are available in countries like Uganda, in Rwanda, in Tanzania, for instance. Some of these mobile apps that are used particularly to report malaria cases are already being implemented. And then we also have these tools that are also helpful in following up TB patients, just to ensure that we're able to provide the required care within the necessary time frame, right? Then most importantly, one that we all are familiar with is the trend on the use of social media to be able to, promote, the right kind of information about disease outbreaks in different regions, all right? So you and I have been involved in the use of social media, even though it has its own downsides. I remember in 2019, was it 2016 rather, during the Ebola outbreak, we had a situation where health misinformation was distributed, and social media in that case was not helpful, but rather, was actually one of the tools that was used to cause more damage with respect to health information. But then social media have played a critical role, especially during the COVID-19 pandemic, where information about how to protect yourself, how to use face masks, how to engage in social distances amongst others, were being shared on social media, and quite a number of persons used that particular tool to be able to promote access to health information. All right. Now, just a bit into our discussion today, looking at some of the leadership styles that are very important when it comes to driving innovation. I've taken time to highlight just 4 key leadership styles and how they can, and showcasing also how they can contribute towards, enabling health innovation. First of all, the first point here is a look on transformational leadership. We have leaders that we refer to as transformational leaders. If you're doing an MBA program, I want to believe that this is a conversation you're already familiar with. This is something that you probably would have been, you've probably discussed already in class, or you've probably read somewhere in the course of one of your notes or textbooks and all of that. But then when we look at transformational leaders, we're seeing these people or individuals who possess this particular quality as leaders who are visionaries. They are individuals who inspire and motivate their teams to think better. They are very, very deliberate about achieving a goal that they have envisioned in their minds. They are leaders who bring about transformation, just like the name transformational leadership, is said to be. Now, when you think of a transformational leader, for a point of context, Dr. Paul Farmer, is one person we want to look at, and one of the things that he did in Haiti, for instance, contributing towards transforming the entire healthcare system in Haiti, a country that has been affected with a lot of disease outbreak, a country that has a very weak and poor healthcare system. He contributed to developing one of the organizations that has helped so far to, support access to healthcare for a lot of communities, right? For a lot of communities across the world. So he developed this organization down there in Haiti, but then the impact of this organization has grown beyond Haiti. And the organization we're talking about is Partners in Health, or PIH, right? That was developed in Central Plateau. And the goal of this organization, when it was formed, was to deliver high quality healthcare to the poorest communities. And by poorest community, it was actually starting with the communities that are based there in Haiti. So far, so good. This organization have gone beyond Haiti and have contributed to free treatment for HIV and AIDS, to tuberculosis, to malaria, to providing access to surgery, maternal and child health services, amongst others, in countries that are beyond Haiti. All right. So this is very, very critical, and is a very, very, very worthy example for what a transformational leader is. So a transformational leader looks beyond, the current problem and thinks how he can come up with, or he or she can come up with a solution that, can reach out to more nations or can address bigger problems. All right. Now, they are visionary leaders and they are passionate about the work that they do. Now, we also have servant leaders, right, or servant leadership. And leaders in this case focuses on the needs of the team. They are passionate about building the trust and psychological safety of the team. They are also deliberate towards ensuring that they work, while they work, they also build the capacity of the people that they work with. And this is one quality, of servant leaders, right? Now, we also have transactional leadership or transactional leaders. These individuals work in a more of a reward-based system, and they are rules-driven. They are passionate about the work that they do, of course. And while this is not ideal for breakthrough innovation, the style of transactional leadership is also very useful, especially in structured environments like hospitals, where there are policies and rules and regulation with respect to, procurement, with respect to recruitment, and all of that. So they work in systems where there are already like policies, or where there is a structured sort of, structured formats for leadership, and they're able to like coordinate activities in that regard. Now, we also have adaptive leadership or adaptive leaders. These are individuals that are very resilient, very passionate, and very dedicated. They are individuals you want to see walk within the storm, right? They're able to face the storm, they embrace changes, and these leaders are excellent during crisis. We've seen the likes of Dr. Chikwe Ihekwazu of the former DG or Director General of the NCDC, as would consider him as an example for an adaptive leader, because in the face of COVID, for instance, he rose to the occasion for Nigeria to be able, he rose to the occasion and was able to create solutions and create policies and set up systems that could help Nigeria combat the situation of COVID-19 as at the time. So I think he is a good example for this particular purpose. So I would give you this as a point of reflection for the purpose of our discussion today. I would say, what leadership style do you currently use? Because for you to be in this program, you're already a leader by yourself. You're already leading in one capacity or the other. All right. I saw that our moderator for the session today is a general manager herself, by the way. All right. Is a general manager herself who is managing probably a big team of colleagues, at a particular hotel. And I'm sure that quite a number of other colleagues on the call are also leaders in their own way. So think about this. What leadership style do you currently use? Are you an adaptive leader? Do you embrace change? Are you a transformational leader who has a vision for the team and also have a vision for the kind of solution or kind of innovation you want to bring on board, and you work towards ensuring that this is achieved? Are you a servant leader who ensures that the team that you work with, that you attend to the needs of this team and you build trust and all of that? This is one question I need you to reflect on. So which leadership style, right, does your organization need right now? So which leadership style do you currently use? And which leadership style do you think your organization need right now? Nigeria's economy is doing like this, all right, in the language of one of our politicians, all right? So what exactly are you doing right now in terms of your leadership style? And then what leadership style do you think your organization need in order for your organization to achieve its vision and its goals? Now, I'll give you a case study that's, of some of my experience, because like I said, most of what I'll be doing is sharing my experience with you, all right? Now, I founded Block Malaria Africa Initiative, for instance, in 2018 in Jos Plateau State, Nigeria. And one of the reasons behind my what do you call it now? My effort in setting up this organization was because of the impact of malaria across communities across Africa, especially Nigeria. We have Nigeria records about 27% of the global malaria deaths. And unfortunately, over 94% of the Nigerian population are prevalent to malaria. And so far, so good. Children under the ages of 5 and pregnant women die from this disease regularly. We have a data that shows that a child dies every minute rather, from malaria. And this is a very, very devastating situation, right? Now, I came up with this initiative, but my interest was basically to see to it that I'm able to play my own part in helping, undeserved or underserved communities, develop their own malaria intervention initiatives or malaria intervention strategies that could help them combat the disease at community level. All right. So the challenge was that malaria was prevalent in underserved communities. And in this case, Genta Mongoro community is a community in Jos North local government in Plateau State, Nigeria. And this is where we implemented this particular initiative in 2019. And the initiative we came up with in order to help address the issue of malaria prevalence was to come up with a youth-led intervention that would leverage the youthful population of that community to help drive awareness on malaria, to also help increase sanitation campaign and initiatives within the community, which by the end of the day would help reduce the prevalence of malaria. And we also worked with a lot of youth-led initiatives like medical association in universities, as well as young professional networks in a lot of the healthcare sector, right, to set up like teams that will carry out medical outreaches for some of these communities because they lack primary healthcare centers. By the end of the project we did in 2019, we reached more than 1,000 people with medical interventions in Genta Mongoro community. We're also able to draw the attention of the government to what is going on in this community, letting the government know that this community lacks access to primary healthcare center, and they are also impacted a lot by malaria. A research was actually conducted, which we led, and we came up with data to prove this fact, all right? And as a result of this, the government ended up distributing over 2,500 insecticide bed nets to support pregnant women and nursing mothers and other members of the society, you know, from malaria. This is one effort that we did at the time. Now, the lesson from this was that in the course of our project, we had no grant and had no funding to implement this project. But we collaborated with a lot of initiatives, a lot of medical teams or medical associations. We also collaborated with local businesses that are based within the Genta Mangoro community. So some businesses provided us with like pure water, some gave us like donuts, you know. Everybody just had to bring what they have to the table to support the volunteers, which we had over 565 volunteers for this project, all right? And when this support came in, we were able to carry out this project, and you can see the data showing the number of persons whose lives were impacted directly by the project. Now, this is to let you know that innovation, first of all, must not always be digital. Innovation can be analog. And in this case, you're seeing an analog innovation, all right? And again, this is to also tell you that innovation doesn't always have to be billions of dollars. It mustn't require billions of dollars or billions of naira. It starts with a passion to identify a problem. It starts with dedication towards solving this problem, all right? It starts with local leadership, all right? It starts with local leadership. And this is true not only in healthcare, it is true also in the various sectors where you work, all right? We were able to use data, community engagement, and advocacy to be able to drive the impact of this project. And we did not rely only on technology, even though social media was very critical in promoting the messages from the work that we're doing at the time, right? So how would you structure a similar innovation in your own sector? You know where you work, you know the sector that you work. How do you, how can you come up with an innovation that could help address a problem in your sector that would not necessarily rely only on monetary resources, all right, or financial resources, all right? So what problem are you willing to tackle, or what problem can you identify that you have the potential to tackle? And then what can you do in order to address that problem, all right? Now, what is a grassroots or field issue in your own case, or what is a grassroots or field issue in your sector that could be tackled with a low cost and high impact approach? I just gave you an example of a low cost and high impact project that we did, showing you what we did, how collaboration played a critical role in achieving what we needed to achieve. Is there a problem within your sector that can adapt this particular approach? All right. It's just for you to think and then come up with your own ideas for your own advancement. All right. Now, there are quite a lot of challenges when it comes to innovation. Innovation is not easy. Innovation is not easily adaptable, right? We already have a system that is sort of a robust stand system. This is not only true for healthcare industry, it's true for even the various sectors where we work. There is already a way of doing things. So when you come up with new ideas, a lot of the times, even the system itself begins to resist the change that you're bringing, all right? I don't know how many of you work in a system where you have top managers or you have executive directors ahead of you, and you're suggesting an idea that you are sure will work. And these people are saying, no, I don't think. We're already used to doing this thing like this, and we don't want to change. All right. So these are some of like the common barriers that affect innovation. All right. There's usually resistance to change. There's also limited funding. Some innovation actually require capital funds, right? And they require a lot of resources. Unfortunately, we are unable to make these resources, we are not able to access these resources, and it affects the efforts that we want to bring into, or the change we want to bring into a particular sector or a particular space. All right. We also have inadequate digital infrastructure. All right. You want to come up with a solution, but this solution requires you to have access to data. But the data for you to drive this initiative is not available because we don't have a system as a country that have this data up to date. All right. And then there's an unclear picture of the return on investment. And there's also the fear for failure. Nobody wants to fail. Nobody feels happy failing. All right. But the truth is, if we're really going to get things right, if you want to bring innovation in any sector, there is a need for you to have that picture that whether you fail or not, the idea is to keep trying until the problem itself is solved. There's definitely going to be an idea that could come in, that could work, that could be adaptable, and could bring about a change. So some of the strategies you can adopt to ensure that some of these barriers are taken away is to ensure that you start small. Most of the challenges we have is that when people want to come up with an innovation, you're always looking at doing something very huge. You want to start big. You want to be the alpha and the omega. You want the world to hear about what you're doing. You want to be the shaker and the mover. It doesn't always work like that. Sometimes when you start small, you use pilot programs. You're able to come up with like a small idea, test run within a community, test run within your company or your organization, do something little, and then when it works, you scale up a little, and you keep moving like that. You need to use data and stories to convince stakeholders to collaborate with you. You cannot achieve innovation sometimes successfully on your own. There's a need to collaborate with other colleagues, or there's a need to collaborate with other businesses, with other companies, with other organizations that share the same vision, or that can share the same vision with the project or the initiative that you're driving. All right. You need to also co-create solutions with users. All right. You need to, if you're creating an innovation, make sure the people who will benefit from these innovations are a part of the innovation itself. All right. Don't do something and then you want to dump it on the people. Create a solution with the people. All right. Or with the beneficiaries of this solution. This is very, very important. All right. There are quite a lot of ethical and regulatory considerations when it comes to driving innovation. Yes, innovation can cause harm, and this is when we don't implement ethics. This is when innovations are introduced without going through ethical considerations or ethical regulations. All right. We have a lot of AI tools today, and in the media industry, there's a rising challenge right now where people are beginning to use AI to design, to sort of simulate the faces of popular individuals and make them say certain words and all of that. So there's already a complaint on the issue of privacy. There's already a complaint for the issue of on the issue of defamation and all of that because of the introduction of AI in the media. This is a huge challenge. All right. Now, AI tools are trained on biased data sets, unfortunately, right? And these have led to a lot of misdiagnosis, especially in African populations. People these days conduct research with cooked data. And when innovations are to be generated, you see that researchers depend on the data that is out there in various high-impact journals or low-impact journals. And when they develop some of these tech innovations, you realize that because the data set they are using was sourced from a place where it ought to be original, but it's fake, right? Now, they come up with, AI tools that, are leading to a lot of misdiagnosis. They're causing more harm than good. This is true for quite a lot of innovations that uses artificial intelligence, right? We also have the issue of contact tracing app during the COVID-19 pandemic that raised a lot of questions about surveillance, about privacy, about consent. All right. You want to do a contact tracing, and people are saying, okay, you're doing contact tracing to identify individuals that probably would have been in contact with an individual who has a disease or who has contacted COVID, right? But then, what if this brings about stigmatization? What if this individual, is not willing to give his or her consent for their data to be taken and all of that? So this was an issue at some point. All right. Now, there are a couple of regulatory frameworks that are already in place. We have the Nigerian Data Protection Regulation. We have the General Data Protection Regulation that covers the European Union. We also have the WHO Digital Health Guidelines, amongst a lot of other regulatory frameworks. All right. But unfortunately, it's not enough to have these frameworks. Whether these frameworks are working and whether there is actually an enforcement of these frameworks or these regulations on on innovation or tools that have been innovated by individuals and organizations is a question that we need to discuss on a different day. All right. Now, what is going to be your responsibility, knowing fully well that we have frameworks that should help regulate innovations, or regulate ethical use of innovations? What is going to be your role as an innovative leader? Your role will be to ensure that you comply with with all of the regulatory frameworks that help that support or guide whatever innovation you're introducing. All right. Especially when you want to commence innovating any form of technology and all of that. Work with the compliance, work with the framework, comply to the framework that is existing. Right. Always secure informed consent when you want to test or when you want to work with beneficiaries for your innovation. All right. Protect user data and uphold transparency throughout your project. Don't be like one of those who will source for funding and in the name of we're going to build this particular innovation, and all of a sudden they're no longer doing the project that they said they're going to do, and to the expense of whatsoever has invested in their particular idea. All right. Now, there is actually a culture of innovation, especially in healthcare organizations. There is a culture of innovation. All right. And an innovation-friendly culture is more powerful than any single tool, all right? An innovation-friendly culture is more powerful than any single tool. If you work in a healthcare setting, or you work even in any setting, the need for you to create an innovation-friendly environment is very important, all right? And one way to encourage this is to ensure that you encourage the idea of sharing. Even if you have anonymous idea boxes within your company or within your organization, it's going to help a lot to support your colleagues or support workers in that particular space to share their ideas for areas of improvement, or share their ideas on how certain projects or certain ideas can be better developed, all right? Create a system where people are free to share ideas for progress, all right? And then reward experimentation, even if it fails. When people come up with an idea to say, this is what we want to do, I'm thinking we can innovate this concept or that concept, all right? Reward them, give them the necessary support. Even if that doesn't work or succeed, at least they believe that they had the support to try out something that would help improve the general welfare or the general well-being of, be it the organization or a project or a health initiative or whatsoever initiative that it is, all right? When you're brainstorming as a team, flatten whatever hierarchy that exists so that people feel free to speak, so that people feel free to be able to have a conversation. I will not consider the example I've given below. Let's take a second case study, and maybe this would also give us a bit of picture to the discussion that we're having, all right? Now, this case study too that I've featured in the presentation is about a radio project that we implemented when I used to work with the Journalism, Communication, and Media Center in the year 2020 during the COVID-19 pandemic. The project was funded by the US Embassy, and it was a radio program that was aired in one of the community radios in Jos, and it was aimed towards tackling vaccine misinformation, especially the COVID-19 vaccine, and to also promote acceptance, to also address the issues of concerns that has to do with the use of face masks and other new policies that were introduced to help us stay safe from COVID. So together as a team, we had the opportunity to have like consistent brainstorming sessions to look at what are the challenges that community members are facing with respect to COVID, and what is the gap between the information that NCDC was providing to the general audience, all right, and the ability for the community as well to adapt this information. So the NCDC shared a lot of information to the general public, but in some instances, some communities were unable to understand either the terminologies or understand the need for certain policies that the NCDC have shared, right? Now, through the help of this program, we produced about 40 live radio sessions and interviewed doctors and other healthcare workers, religious leaders and traditional leaders, including members of the legislative arm of government, to talk about what the government is doing and what the government have done to support, be it welfare, be it healthcare services and all of that, all right, within the period. We use storytelling, we use callings, during the radio program to address some of the myths that people had about COVID. And this worked a lot. And it worked because we were able to give access to this information to a low literacy audience. It worked because we also had multi-sectoral partnership, and this was between media, health, and donors, right? And it also worked because we also worked directly with the beneficiaries of this particular project. We're not only coming on radio to just talk, we had a listeners group where we also engage with the participants and discuss with them. This is a concept of innovation because it's not something that is common, especially across other radio programs that you find on radio stations generally. And the lesson that you need to learn from this is the fact that innovation is not always going to be digital, all right? That innovation can be analog. Innovation can be changing the position of the water dispenser from where it used to be to where you feel it can better serve the general the interest of the colleagues or the general workers within your workspace. All right. So there's a need for interdisciplinary innovation. There's a need for collaboration of different sorts. If you want to succeed as a leader who is an innovator, you must learn to collaborate. Collaborate between healthcare workers, have collaboration with IT, data teams, or data scientists, collaborate with project managers, regulators, with donors, all right? You must find a way to collaborate because until you collaborate, certain innovative ideas cannot even be established, all right? Your leadership has to bring people together. Your leadership has to facilitate joint planning. Your leadership has to build systems for accountability. And what that indicates is that as a leader yourself, you must learn to be accountable. You must deliberately contribute towards the growth and development of your people or the people that you work with. You must show that you're accountable and you can be held accountable for the ideas that you share, all right, and for the concepts that you implement. This is very important. The last case study that I'm going to be discussing, just as we look towards wrapping up the session, is the case study of the African Leaders Malaria Alliance scorecard, all right? Or the scorecard hub. We call it the scorecard hub or the ALMA scorecard hub, all right? A lot of financial resources are deposited into the fight against malaria, all right, amongst other illnesses across the world. The African Leaders Malaria Alliance is the coalition of the 55 African heads of state working under the African Union to ensure that African governments make a deliberate financial contribution towards ending malaria within their respective countries. All right. I happen to serve as the vice chairperson for the Youth Advisory Council that helped to advise the coalition on how African leaders can work with young people in their respective countries towards ending malaria. At a point, there was a realization that so much money is invested in this fight, yet there is no picture of how the money is utilized. There's no picture of the real situation of malaria in certain communities. So we fail to prioritize like the most endemic communities when deploying like malaria intervention. And this brought about the need to come up with this tool that is called the Scorecard Hub or the Scorecard tool. It is a digital tool that is used by African heads of state through their national malaria control programs, all right, to help track malaria progress. And it's also a tool that shows a picture of how much investment is made on malaria, all right? So we realized as a Youth Advisory Council working on the African Leaders Malaria Alliance that young people who have been brought on board to help hold leaders accountable for malaria elimination had limited access to the data around malaria and around the investments on malaria in their respective countries. And when this realization was made, the African Leaders Malaria Alliance became deliberate about training and mobilizing young people across the continent towards using the scorecard tool to lead advocacy and also drive accountability within their respective country. And so far, so good. This tool is currently used in about 16 countries. Young people are using this data sourced from this tool to track government commitment to end malaria. They're using this data to advocate for better funding for malaria programs. They're using the data to improve community awareness on malaria. They're using the data to also facilitate malaria interventions, especially for endemic communities. So what this shows you is that it's not about just creating an innovation. Sometimes you can create an innovation and then the innovation doesn't have a space for where it can function, or it doesn't have, there's no modalities for this innovation to be better utilized, all right? So when you create innovation, you must look at how this innovation is utilized and how this innovation can make the greatest of impact, all right? And the lesson from this is to see, first of all, that when data, youth, and policy intersect, or when data, youth, and what do you call it, and opportunities intersect, all right? There's a change that can occur, especially in Africa, where we have a greater percentage of young people. About 60% of the African population today is said to be, is said to be young, right? So we can leverage young people, especially when developing your innovation. I know we have a number of young people on the call as well. So I'm advocating that when you're developing innovation, whether it is a digital innovation or an analog innovation like we've rightly seen, it is really important that you work with young people because they make up like the larger population of the society. They have the energy, the passion, and the time to be able to, be it help you test those innovations or help you drive acceptance for that innovation. So it is in your best interest. It is also to your advantage when you work with young people, and there are quite a lot of smart ones, a lot of them in Nigeria and even in Africa, all right? So this is one thing that I think is very, very important. Now, as we wrap up, I have a final reflection and a leadership challenge I want to pose to you. It's something I want you to go back with. It's something I want you to go back with and then think about and come up with a solution for, come up with like a way to drive this innovation within your workplace, all right? So the question is, what one thing will you do in the next 30 days to spark innovation in your workplace? I know that from the start of this presentation down until now, you have probably thought about one or two challenges that you're probably facing in your project or in the company where you work or in the organization where you work, or even with your MBA program. What one innovation can you come up with that can help address this particular challenge that you've been thinking about in the course of this presentation? What is one thing you will do within the next 30 days? So it's something that maybe Chiamaka and the team can hold you accountable for. All right. So, but what is one thing you think you can do to be able to, spark innovation within your workplace? If you have the courage and you're bold enough, you can feel free to share that with us in the chat. And we are not going to hold you accountable for it anyway. But then feel free to share if you have thought about something in this direction. All right. So, in conclusion, for this session, I would share something that I think is very important for us to know. And this is actually the center of the entire discussion that we've been having today. We've talked about technology, we've talked about the need for innovation, and we've talked about why innovation is important, especially in low and middle income countries. We've said that issues around, a poor infrastructure in terms of our healthcare, issues around, the lack of access to healthcare services, issue around shortages of healthcare workers, amongst others, have made innovation necessary, in the Nigerian healthcare system or in the African healthcare system. All right. We've also looked at some of the technological tools from artificial intelligence, some of the trends rather, from artificial intelligence to mHealth devices, to social media, to, electronic health records, amongst a long list of others that is currently helping us to bridge the gaps, right, when it comes to, access to healthcare services in Nigeria and even in Africa. But then I've also made it clear that innovation in itself is not only digital, that innovation can be technological, right? And it can also be analog. So innovation can be both digital and analog. The digital part of technology of innovation is the technological aspect of it. The analog part of innovation is the leadership aspect of it, where you need to step in and create a solution that can be adaptable and can bring about a change. So to wrap this session up, I want to point to you that technology doesn't drive change. We can create these technological tools, and then they cannot be utilized or they cannot solve the problems that they've been created to solve. It is the people who actually drive the change. So it's one thing to create a technology. It is one thing to be the visionary leader, to be the transformational leader, to be the servant leader, who have the passion to work with your colleagues, to collaborate, who has the passion to ensure that this technology is better utilized to the best of its interest to solve the problem that has been identified or to solve the problem for which it has been created to solve. All right. So technology doesn't drive change. It is people who do. All right. Now, and systems don't transform themselves. Systems don't transform by themselves. It is leaders like yourself who make it happen. And this is exactly why you are in the Rome Business School in Nigeria. So it is the perfect place for you to learn. It is a perfect place for you to gather the experience that is required, to meet industry leaders, to share your own concepts, and then to also collaborate even amongst your classmates and colleagues to come up with the perfect solution that can help you to solve one problem that the society can appreciate you for. All right. So I urge you right now to be on your feet as a leader, to deliberately work towards creating a solution, to look within your workspace and come up with one solution for a recognized problem, or to start, first of all, by identifying a problem within your workspace or within your sector that you think only you have the idea to initiate, or only you have the ability to initiate an idea that can solve that problem. And when you do, find people that can align with you, that can collaborate with you, and then lead the conversation from there and create a solution that can help us, benefit greatly from your sector. All right. So thank you so much for your time. I will be happy to take your questions and then hear some of your contribution as well with respect to the conversation that we've held so far. This is where I will be cutting off the presentation. Thank you so much, Chiamaka, and thank you so much to the entire team at Rome Business School for inviting me over to come and share my little experience. I just hope and pray that you were able to pick one thing at least from in the course of the discussion that we've held today. Thank you so much and warm regards. Over to you, Chiamaka.
All right, thank you very much, Mr. Kingsley. So we have our moderator here. Ms. Tosi, are you ready? Can you take over flow?
Fantastic. Welcome, Tosin.
Ms. Tosi Yusuf, if you can hear me, can you unmute, please?
Hi, hi, good evening, everyone. I really apologize for not being here at the time. I had a situation that was literally out of my control. But I want to say thank you for to Chiamaka for taking on and doing such a wonderful job at introducing our very, very wonderful speaker for today. Sir, you did a very amazing job with this topic. I am literally I am amazed at the things that I've learned. The ending was the peak for me. I learned so much, and I just want to say thank you for sharing your knowledge and your thoughts and your innovation with us today. It's time for question and answer session. If you have any question, please feel free to drop it in the chat box. I have prepared my own questions, so while you drop your questions, I'll go ahead and ask the questions that I've prepared for our speaker today. So sir, you spoke about certain AIs, how AI could be partial in giving the right recommendation in healthcare, and those are like setback in digital innovations, right? Are there any tools or mobile applications that you can say, okay, to an extent, we could use to get certain information when it comes to healthcare?
Yes, thank you so much, Tosin, for that question. And so far, so good. There are quite a lot of tools that are being innovated, but then what we advise a lot of the times is that while you are able to source information from, AI-driven or AI-related tools, like maybe the ChatGPTs, amongst others, it is important for you to always cross-check the information that you source from these platforms, with the information shared by credible and relevant agencies like the WHO, like the NCDC in the case of Nigeria, for instance, amongst, and the Federal Ministry of Health, amongst others. I remember vividly during the COVID-19 pandemic in 2020, there were quite a lot of misinformation that was actually even shared through, AI-driven tools, all right? And the NCDC had to step in at some point to start educating the general public, on the need for them to access information about COVID only from their platform or from the WHO platform. Like I rightly explained earlier, a couple of these, in fact, all of these AI tools are not just developed on their own. They are developed using already existing data that is probably sourced from, the internet and then from research hubs, all right, or journals, right, or from even some of the organizations that are giants in a particular sector where the AI is developed for, right, amongst others. And in some instances, because the data that is developed, that is generated from these platforms, or the data that is available on these platforms, are either outdated or they are not accurate in themselves, right? We end up coming up with AI tools that are built on the basis of false data or fake data. Do you understand? And this is where the challenge comes from. So, but the WHO will always update its platforms with the necessary information. There are times where you receive maybe a WHO guideline that was developed maybe for between 2016 to 2021. And by the end of 2021, this guideline is considered to be outdated. A committee is set up by this institution to review the old guideline in the context of current realities. And then a newer guideline that can help solve the problems in current times is developed. And so you can trust to a large extent, the information you're sourcing from, WHO, from the NCDC, the Federal Ministry of Health, and all of that, because they review some of these things regularly, all right? We can't say the same for quite a number of the AI-driven tools that we have in the market. So I wouldn't say, I wouldn't recommend any in particular to say, go source your information from here, but artificial intelligence make our life easy. They make our work easier and faster. So when you use them, learn to always go and cross-check the information you are getting from them with a more reliable and trusted platform, like some of these platforms that we've mentioned, just to make sure that the information you're sourcing is important. And it's also important to learn prompt engineering, because sometimes the AI devices don't only, it's not like they give you a fake information. Sometimes it is the kind of prompt you throw at them that determines the kind of information that they also give back to you. So if you don't know how to prompt the AI properly, you won't be able to get the necessary and the best of information that you need, right, from these particular devices or from these particular platforms, all right? So I hope that responds to your question appropriately, Tosin.
Yes, it does, but it then brings me to a follow-up question. I'm sure your answer already answered one of the questions in the chat box asking where we can get reliable information from Nigeria, like anywhere we can get like public data in Nigeria healthcare. But now I want to ask this question about AI and healthcare. I've seen different situations, different memes, different video online where people go to see their doctors and their doctors are relying on AI to be able to diagnose their patients. What would you advise in that, because it is not feeling like people are taking themselves away from the traditional or the normal way of learning and understanding what the situation actually is per patient, and they are relying on AI's results, and that's what they now like just bring up. Like, how are we supposed to manage that kind of situation?
Yeah, so thank you, Tosin, for that question. Just to say, in addition to the previous question, because you said there's a question in the chat box from that direction, there are actually organizations that work around ensuring that we have clean and credible data. Organizations like Data Fight, for instance, all right, or organizations like Budget, are organizations that are working to ensure that we have very credible data with respect to different sectors, all right? So if you're doing things around governance, around developmental projects, amongst others, you would want to trust data that is sourced from Budget, all right, or some of the apps that Budget have developed, like the Track It app, the Open Governance, amongst others, all right? Data Fight is also one place to go source data from. And then some of the agencies responsible for the particular sector you work, you can also go to them to source for data, all right? Sometimes they have this data, but they don't just make it available to the general public, all right? So that is one thing. Now, back to what you're saying, the next question you've sent or you shared, Tosin. To be honest with you, artificial intelligence have come to stay, and whether we like it or not, we can't do without it entirely. The population of the world and even the population of Nigeria is growing and is advancing. We're already in the situation where the patient to doctor ratio, for instance, is widening apart every single day. The number of healthcare professionals currently available in Nigeria, from medical laboratory scientists to doctors to nurses, amongst others, are very, very limited as compared to the number of patients who are seeking care and services that is required. Unfortunately, as well, the issue of infrastructure that we're talking about, we don't even have up-to-date machineries in our facilities that could help to support diagnosis, all right? So a lot of the times, the AI tools that you see your clinicians or your scientists, amongst others, using is not necessarily like the ChatGPT, let me ask this question and all of that. There are actually some tools that have been developed that can be linked with machines abroad, all right? There are actually some tools that are currently operating on data banks, that are sourced from other countries where this data is available, all right? Then there are also tools that can also help to interact with other healthcare professionals that are working in developed countries. So like the concept of telemedicine, right? Where an individual can just be at home and just use their phone and seek the services of a doctor, all right? And then get consultation services and all of that. Do you understand? So we're already having tools in this direction. I totally understand that some healthcare practitioners are already abusing the AI itself, and then persons who don't know how to ethically use AI are beginning to use it to the disadvantage of the patient because it gives maybe wrong clinical diagnoses, amongst others. However, the ratio is not you know, is not that huge yet, all right? And this is why we're having these conversations. I know we have individuals who are into healthcare policy here. We have individuals who are also working in the healthcare sector. These are the conversations we need to be having right now. How do we train and empower healthcare workers to start, you know, understanding the ethical use of AI? How do we make them understand that AI can be used unethically, and this can bring about misdiagnosis and can also bring about deaths in a lot of instances, all right? So I understand and I agree with you that this is actually the reality of things. However, AI is helping to promote a lot of healthcare services or promote access to a lot of health services that ideally we wouldn't be able to access because of our infrastructural system right now with respect to healthcare, all right? So we just need to identify the problem and start creating solutions to the problem. That's what we need to do right now. But as for the problem, it exists. That is true. Right.
Okay, thank you. Thank you for acknowledging the problem.
Yes.
Finally, before I move on to some of the questions in the chat box, we don't want to take much of anybody's time. We want to wrap up as soon as possible, but I need to ask this question. You, at the beginning of the lecture, you talked about the Japa syndrome, and a lot of our medical practitioners have escaped abroad because there are better working conditions and so many other reasons. What do you think that the Nigerian government can do about this in order to keep our own medical practitioners locked down? I'm sure they have their reasons for moving. Is there I've heard of situations where they've denied visas to, or deny even giving passport to medical practitioners so that they are not able to travel. But in the real sense of it, what is the ethical way to make sure that we can keep our own people here? Because before you know it, if all the medical practitioners have to leave the country because of poor working situations or whatever reason, then we'll be left in drought in our medical area.
We are already in drought, my dear. That's actually our current situation. We are already in drought. If it is that one, we are far behind. I was just at the Federal Teaching Hospital here in Azere just a few moments ago, and this is actually one of the conversations that we're having, right, with some colleagues who are working at that particular facility. Quite a number of healthcare professionals are currently, as we speak, sitting for a number of professional exams, preparing to leave Nigeria by September. I met about 5 persons who are currently set to leave. 5, working in one particular unit. So I don't know the case in multiple other units. So if we think if the drought, if it's about the drought, it's already here. I think we just need to learn to tell ourselves the truth as a people. We're already at that point where we are no longer, let me say we're already independent as a nation. All right, we're responsible for our health, our welfare, and our health and our care as a people. The Nigerian government knows what it needs to do, but it is the concept that we are currently discussing. The need for us to have visionary leaders, the need for us to have transformational leaders who understand that you need access to quality and affordable healthcare for people to be alive, for you to eventually leave them. If the people you're leading die of infectious diseases because they can't access services to treat themselves and be fine, then at the end of the day, we'll wake up to a country with no humans at all. And then we eventually know who exactly anybody is going to lead. Do you understand? So we're already at that point where government just need to increase its investment in healthcare. If you look at the budgets, for instance, for our healthcare industry in Nigeria, it is actually a shame. It is actually an embarrassment. It is here in Nigeria where countries met and adopted what we refer to as the Abuja Declaration of 2001, that every country is required to make about 15% minimum budgetary allocation for healthcare in its country. Nigeria till date have never crossed 7% of that particular agreement, all right? And we keep having budget go up to 5%, it drops down to 4%, it goes down to 3%, and unfortunately, this is where we are right now. A lot of facilities don't have the requisite machineries for you to be able to carry out proper diagnosis and treatment of patients. A lot of the facilities don't pay healthcare professionals in the required amount that they deserve or in the required amount that they need to earn, especially in this dispensation, when the economy is going down every single day, nobody will be offered a job that will pay them 15 times their salary in Nigeria and then choose to stay in Nigeria. The issue of insecurity is still one major challenge. If you go to various areas or various regions of the country, healthcare workers are still being adopted, by kidnappers amongst others, and this is a growing challenge. All right. Now, you can't go to school, spend 6-7 years of your time, 8 years in some instances because of the failure as well in the educational sector. And then you come out expecting to live a better life and then have the facility to better contribute towards the wellness of people. And then you don't have those opportunities on the ground. So we need to increase investment. We need to come up with better initiatives that can help us strengthen our healthcare system. We need to encouraging healthcare workers to stay will not solve the problem. Creating a better welfare for them is more of a better alternative. All right. Increase the welfare of healthcare workers, support the development and the availability of improved infrastructure or healthcare infrastructure across the different regions in Nigeria. And once you do this, support the growing, address the growing security situation or the insecurity situation, and make sure that healthcare workers can be safe and secure to travel to anywhere in the country and work peacefully, all right? And then even improve the economy. If you do this, healthcare workers are going to stay in Nigeria. There will be no need to go anywhere else because after all, there's no place like home, right?
Yes, right. There is no place like home. So I'll go on and read some of the comments and questions in the chat box. This one is from Gideon. It says, thank you so much for the interesting presentation. When you talked about the innovative solution of monitoring malaria and the African condition, I could not help but think about the environment, which makes implementation very difficult. The fund spent is usually does not commensurate with the results due to large corruption. And that's from Gideon. Maxine Okon says, thank you, Mr. Odinaka. You spoke so well on the control of malaria. Malaria has been an age-long problem to Africans, and over the years till date, no vaccination on malaria. Is it also possible to look at the malaria challenge from side of trying to have a vaccine?
Yes. So just to add to that, we actually have 2 vaccine candidates for malaria that is currently available in the market and have been approved by the WHO for use. As a matter of fact, currently, as we speak right here in Nigeria, Kebbi State and Bayelsa State are currently rolling out the vaccine. But then this vaccine is specifically for children under the age of 2. So universities like Oxford, amongst other international organizations, are still working to ensure that we come up with other vaccines that would support the immunity of adults, right, with respect to malaria. But then we have 2 vaccines. We have the RTS-ASO1 malaria vaccine that was developed by GSK and PAT. That one was approved in 2021. We also have the R21 matrix malaria vaccine, which was developed by Oxford and is also been approved by WHO and has about 77% efficacy. So we have 2 vaccines. A lot of African countries have rolled them out over the past 3 years, from Ghana to Malawi to Burkina Faso and recently Cote d'Ivoire, amongst a number of other countries. And then we are seeing very, very rapid progress in terms of improvement, of the issue of malaria, especially amongst children that the vaccine is designated for. So more innovations are required for us to have better vaccines, and then to also have to also have better solutions towards addressing malaria. And that is the reason why some of us exist. All right.
Okay. Thank you very much. That's a beautiful one. We are happy to know that we can move forward with solving the issue of malaria in all across the world. So I wouldn't be reading comments anymore because of time. I would only take questions. Lazarus Anikwe says, please, what do you consider as the biggest barrier you see to implementing innovative technology solutions in healthcare, and how might leadership overcome it?
Thank you so much, Lazarus, for that question. You see, I'm not sure there's something that is the biggest challenge, right? All challenges are big challenges. when it has to do with creating innovative solutions. All right. There are individuals who have come up with startups to help develop technological tools to address one healthcare issue or the other. And then these innovation hubs are cited in places where they have the right kind of expertise, and they have volunteers, they have the opportunity to collaborate with other data scientists and other experts in IT from other countries. But then their major challenge is getting the required funding to be able to scale up the innovation that they've developed. There are also individuals who are in a situation where they are even unable to create the platform to have, this innovation happen in the first place. All right. Then to make it worse, we have I personally think is a stigmatization of young people who are into tech, right? Sort of, recently I had a friend who was arrested by the police on the road. And what was the case? He was having afro and all of that. And then, police arrested him and saw computers and all of that. And before you know it, the conversation is, this person is a Yahoo person and we need to detain this person. You need to give us also amount of money. These are some of the issues that young people are faced with across different parts of Nigeria. And this is also a huge challenge when it even has to do with innovation, especially digital innovation. Young people who are into tech no longer have the passion. They are no longer driven. They face a lot of security situation, even when they move around from place to place. So everything literally in Nigeria is fighting you as an innovator, all right? And this is the reason why we keep emphasizing that having a leader who has a vision, like having the right policies in place that will protect the interests of innovators, having things like hackathons. I think there was one by the Eco Innovation Center about 2-3 years ago where I was invited to be a jury. We had a lot of young people who came together to contest in a hackathon, to come up with like the best healthcare innovation. And the winners went home with about ₦1 million. All right. So can we have organizations roll out some programs in this regard that can help inspire young people to continue innovating, especially the ones who are already innovating, and then encourage others that are not innovators to also drive in that direction? Then can we also have funds available that will help support research and innovation in Nigeria? Unfortunately, it interests you to know that Nigeria as a nation is supposed to have certain budgetary allocation that is designated only for research and innovation. The last time I checked, I think maybe the 2017 budget or the 2019 budget of Nigeria, what we had was about just 3% of the Nigerian budget designated for research and innovation. This is not right. This is not required. This is a huge problem. All right. In countries where we celebrate IT, we celebrate a lot of innovation in IT, a lot of innovation in other sector and all of that, you see a huge amount of money designated for research and innovation. So even universities are empowered to have research centers, projects are funded and all of that. The African Leadership University, for instance, in Kigali, Rwanda, I visited in January earlier this year, and they have an innovation hub where children or students rather, or young people within first year, second year, third year are already amassing over $6 million in grant for research innovation or for technological innovation that was conceptualized within the university system. This is right here in Kigali, not too far, let's say, within, from Nigeria, but within the same continent. All right. So for goodness sake, can we start ensuring that our universities are not just giving notes to people to just go home and then all of that? Can we start creating like an atmosphere where research and innovation can be promoted within our university or within even the entire Nigerian educational system, from primary to secondary school to university? This is feasible and this is possible. It's not going to take only the budget. We need to have these policies implemented in the educational sector. We need to have research and innovation also embedded in healthcare. We need it also embedded in science and technological, science and technological agencies, amongst every other sector of the economy. Even HR, there's innovation in HR. There's innovation in project management. There's innovation in finance. How many of our banks, how many of our HR companies are operating at global level with respect to the level of innovation that is required of them? So a lot of challenges are affecting, the growth of innovation, or is affecting the innovation ecosystem in Nigeria. All right. And policies are required, funding is required, but most importantly, the political will to make the ecosystem safe for innovators is also one of the most important things that is required at this point. All right. Lazarus, I hope this has answered your question. Tosin?
All right,
Tosin,
so we'll be taking Elijah's question now. Elijah, kindly ask your question. Elijah Isaac, kindly ask your question, please.
Yes, okay. Good evening. Good evening, all. Thank you, Mr. Kingsley, for the wonderful presentation. All right. My question, you talked about misuse of the malaria funding. So what do you think is a possible solution to this? Because I am also in the healthcare sector and we've experienced things. So what do you think is a possible solution or suggestion? Thank you.
All right. Thank you so much, Elijah. I think, first of all, the issue that has brought about the misappropriation of funding, this is not only true for malaria programs, this is true for other programs targeted at different other healthcare issues, all right? We just need the right kind of accountability. There's a need for us to, to be accountable as a people, and there's also a need for us to ensure that people who are accountable are in the helm of affairs when it has to do with managing the resources required for this intervention. You are in the healthcare sector, like you said, and I'm sure you must have heard of situations where budgets are made for projects in remote communities, and then these budgets are divided, all right, by stakeholders. Instead of this budget used for the project that is supposed to be used for, there's a division of ABC, category A. This budget, this money is going to cover our welfare as a people. Then this other budget, 30% of the budget is now going to be used for the what do you call it, for the project that it is meant for. So the solution we need is basically accountability. We just need to have accountable leaders who are going to manage these resources. And then as a people, we need systems like the scorecard hub, for instance, that can help us monitor the progress that is made with respect to, addressing some of these healthcare issues, right? We need to have these systems. And if you work in the healthcare space, it is your right and your responsibility as a citizen of the Federal Republic to be able to also, hold the people you work with accountable and also be accountable yourself. We are already at that point where where countries like the US are cutting off funding. I'm sure that in the next few months, we may have the same situation happening to funding that we receive from countries like Germany, from China, and amongst others. What are we doing as a nation? Now, a lot of our healthcare programs are left in the open. We are already, instead of making progress, the progress we've already achieved, we're already going backwards. We're losing down on the progress that we've already achieved because we had never made plans to start developing finances on our own or to, to fund domestically some of the healthcare interventions that we run in the country, all right? Because monies come from outside, so we feel let's spend it, all right? So we need to start becoming accountable, and we need to set accountability system, and there should be policies that can keep people accountable, and there should be policies that can also penalize people when they're not accountable. When we start with this in this direction, I think we're going to be on the right path towards recording success.
Okay, thank you so much, Mr. Odinaka. I think it's one thing to create policies, is another thing to implement those policies. There is a question from Bukola Omoni. It says, my question is that, is it true that COVID vaccines was a scam used to control the world population, especially in Africa? Nothing happened to the people who were not vaccinated in 2020, whilst some school of thought insinuated a decline in their productive system since they got vaccinated. Thank you.
Well, thank you so much for that question. This is still one of those issues that we're still dealing with right now, the issue of misinformation, misconception, and myths, all right? Now, well, I'm a medical lab scientist myself, and one of my major areas of interest basically is actually the concept of vaccination. And I would say this to you, a lot of ideas and a lot of myths and misconception have been said about vaccines. And anytime we have a situation where vaccination is required, people just come up with ideas. And then these ideas sometimes, like they say, the more terrible the news, the more exciting it is to be received by the general public, right? Now, I would say to you that the aim of vaccination is to, help protect us as a people from certain illnesses and all of that. During the COVID-19 pandemic, there was a lot of effort to ensure that more people were saved and protected from COVID than the number of people that died. you're saying that you don't have there are people who did not take the vaccine, did not die, but you don't have data to literally show that. Yes, some people did not die because their immunity was able to carry them. But actually, if you look through the NCDC website, even, you will see clear information on deaths that were recorded as a result of COVID. I personally lost a number, I think there were 2 professors or so from my university that died as a result of COVID. When they were diagnosed, they had COVID, and as a result, they passed. And there are quite a number of situations. So sometimes when you don't have a first-hand case, it's like telling somebody that people die from malaria in Nigeria, and they will say, malaria that everybody lives with. But unfortunately, this, about 88,000 people, 88,000 deaths were recorded from malaria alone in 2020, if I'm not mistaken. All right. Now, this is a very serious issue. 75% of that number is actually children under the ages of 5. All right. So the fact that you've not seen anyone die from the disease does not necessarily mean that people are not dying from it. Nigeria is a country of 220 million people. We're estimating 230 million people as it is right now. So if something is happening in Sokoto, in one community in Sokoto, there's a difficult tendency that you may not be able to know about that until it is reported by the news. And these days, because the media controls the narrative, there's also an agenda to see to it that we don't always report all the negative health news so that people don't get scared and people don't start doing things that is going to cause more harm to them. All right. So there's a bit of effort to manage that to manage that scenario. So I don't believe, and I don't key into that school of thought that the COVID-19 vaccine is an agenda to reduce the population of the world and all of that. Polio vaccine did not reduce the population of the world. People are still safe from, when they take the vaccines. And those who didn't, for instance, in some cases, we're still struggling to manage the situation of disability amongst others. All right. Right. So basically, I think that would be my response to that question.
Okay, that was a very insightful one. I'll take a question from, excuse me, please. Okay, I'll take this question from Elijah. Isaac is asking, we have less than 40% scorecard for vaccine acceptance and administration in Nigeria. What is the way out? I would also like to combine that question almost immediately. He says, this is from Waonia. I'm sorry, I couldn't get that name, but hi everyone, this is a contribution on the COVID issue. Okay, I agree that some people died from not taking the vaccine. I also have people who took it and affected. Yeah. Okay. Please just talk on the acceptance of administration of vaccines in Nigeria. A lot of people do shy away from it. I remember a particular time they were giving yellow fever vaccine in my area, and a lot of people were like, oh, they are scared, they don't want to take it, or their hands will get swollen, or they're using it to track them, or it is not healthy for them, and they just didn't take it. They just didn't accept it, and it was free, and they did not know the importance of having that vaccination.
Thank you so much, Tosin, and then to Elijah as well for that question. I totally agree with you. The issue of vaccine acceptance is one of the major challenges that is bedeviling public health, especially in Nigeria, and even in a couple of countries across the African continent. The truth is, as a people, we have to get to that point where we prioritize our own healthcare. We have to get to that point where we understand that when we do the right things with respect to our healthcare, we also do that. We also protect the interests of other individuals who are also living within us, or who are also living around our environment. All right. This is very important. Unfortunately, there's rolling out vaccine programs require a lot of effort. Vaccines in themselves, will not be administered, will not just get into our system if we don't receive them. So there's always a need to develop vaccine programs in collaboration with those who the vaccines are meant for. The major challenge that we've had over the years is that when vaccines are to be rolled out, the necessary or relevant agencies or ministries responsible for such rollout does not spend enough time in educating the general public about the vaccine, its impact, its usefulness, and then if there are side effects, its potential side effects. They don't make a lot of investment in earning the trust of the people before these vaccines are administered. And this is where the challenge always comes in. People will only take a medication that they can trust. And I think we even saw this during the COVID-19 vaccination, during the COVID-19 pandemic. There were millions of COVID vaccine vials that were destroyed because they got expired due to vaccine hesitancy, all right? And this is a very, very serious conversation right now in public health. These vaccines cost a lot of money to be developed. It took a lot of time. A lot of efforts are put in to ensure that vaccines are developed to be able to help support the immunity of a general population or support the immunity of a country, all right? Unfortunately, because these vaccines are given for free, the people who receive these vaccines think the vaccines are free, but the vaccines are not. Millions and millions of dollars are spent in development of these vaccines. In a bid to address this issue, my personal recommendation over the years have been that Nigeria as a nation has the capacity to begin production of its own vaccines. We have trained and licensed medical laboratory scientists, pharmacists, doctors, and other professionals who are vaccinologists and are working in the areas of vaccine production in other countries. We also have centers like the National Veterinary and Research Institute in Jos. We have the Vaccine Production Center in Yaba that have been abandoned for years. We have other facilities that have what it takes if right investments are made in that direction to help Nigeria commence the production of its own vaccine. If we're able to get to that point where we're able to develop our own vaccine, I believe as a people, we would learn to trust our own product. We would learn to also, the access to these vaccines are also going to be easy, all right? And then even the general public would learn to accept these vaccines and then utilize them for their best interests. But there's also a need for agencies responsible for rolling out vaccine to invest time in educating the general public on these vaccines before they are rolled out, to also create channels where complaints, queries, and every concerns about these vaccines can be responsibly handled or responsibly attended, all right? When that is not done, you don't just come up with vaccines and dump on the people. If they don't trust it, they won't take it. I'm a human myself before I became a scientist. And this is some of the conversations that we need to start having, all right? Thank you so much, Elijah, for that question.
All right, thank you so much, sir. It's a very rich session and we have spent so much time and we need to move on so that we can get on to other businesses. Thank you everyone for sharing your ideas and your questions. We really appreciate your time in joining this session. Thank you so much, Dr. Odinaka, once again. We really appreciate your time. I would like to call on the Career Service and Alumni Relations, and that is Chiamaka, to fill us in on what they are for us in that part of Rome Business School. Thank you.
All right. Good afternoon.
Chiamaka, your line is breaking terribly.
All right. Good afternoon. Good afternoon, everybody. Can you hear me?
Hello.
Good afternoon, everybody. Please, can you hear me?
Yes, loud and clear. I think we can hear you.
All right. So from the career service decks, we would like to invite you to the upcoming career fair. The career fair will be happening here in Lagos at Masenina Event Center come July the 18th, 2025. Rome Business School's Career Service and Alumni team would like everyone on this call to be in attendance. It's going to be an opportunity for everyone in attendance to reach out to new networks. It gives them the opportunity to reach out to headhunters that will be coming there sourcing for talents. We have the likes of Jobberman. We have the likes of company like Workforce, Chi Limited, TGI, Silverbird Group, all in attendance for this year career fair, and all these companies will be recruiting. We also have the likes of My Sigma, Goshen Laboratory, and they have also offered to do free testing for everybody that will be present at this year's career fair. So there's a lot of activities to be carried out this year career fair. July the 18th is the date. The time is 10 a.m. The venue is Masenina Event Center. The registration form will be posted on the chat box in intervals. Please fill the form to attend. The attendance is free, but registration is compulsory. So please do well to register in order for you to attend. It's going to be one packed event. It's something that you don't want to miss. So do well to register and attend. On that note, I would like to bring my colleague to take and give us some information from the admissions department in person of Mr. Idowu Adeleke. Mr. Idowu, are you here on this call with us, please?
Yes.
All right.
Good
Over to you,
afternoon,
sir.
good evening, everyone. First, we'd like to appreciate Mr. Odinaka Kingsley for the very insightful section, and then Tosin Yusuf for moderating. Thank you very much. My name is Idowu Adeleke. I am one of the key account managers in the admissions department of Rome Business School. So I'm just here to speak briefly about the institution, and then also to speak to both students and prospects that could most likely be on this call. So Rome Business School is an international business school, the main campus from Rome, Italy. What we have here is a satellite campus of the school. Just as you've heard from my colleague Victor, the career fair is next week, Friday, precisely on the 18th of July, and is open to all students and even prospects. And one of the highlights of the event is immediate interviews for students that are looking at opportunities and then also having conversations with headhunters. And also there'll be sections on how you can advance in your career. We'll be having consultants speak at the event. And then also the companies that will be coming to actually speak with our students. Now, apart from that, from the admissions team, every month we give special considerations to prospects. So if a prospect on this call, this is just a bit of what the classes would look like. You would agree with me that this has been a very insightful one. So it's just an opportunity for you to have a bit of the feeling of the class, okay? So come in, it's a very good time for you to speak with your admission advisor, reach out to him, reinitiate the process or conclude the process of your admission, and then join. There are financial considerations every month, and you can also take advantage of this in the course of your admission process. So it's been a wonderful time being on this section. Thank you so much for your time, and we look forward to having you during the career fair. Thank you.
Thank you very much, Ido. Thank you very much, Mr. Kingsley, rather. Thank you very much, Miss Tosi, for your time. We really appreciate your time. We appreciate your efforts. We appreciate the information you've been able to pass across to our executive students this evening. It was one session that I'm sure will be at the tip of their tongues for a long while.
Thank you so
Please,
much.
we would like to have you again some other time in future for you to continue this topic and also more topics. Thank you for attending. The career fair registration form has been sent on the group platform for those that are students. For those that are prospect as well, the attendance form, registration form is on the chat box. Do well to fill and submit in order to get recording of this session. Please also fill and submit the attendance survey. We'll be sending in the attendance survey as well. The session has come to an end. However, I will leave the Zoom open till 4:55 to enable us fill the career fair participant attendance form and also the attendance form to get the recording of this session. Thank you again for joining this session. Have a lovely night's rest. Bye for now.